low, because we have to avoid discrimination. Okay, class? So we have to be conscious with the terms that we use when we say lack, or when we want to kung ang ibig sabihin natin ay lack, meaning meron silang kakulangan, so that is something negative in their with negative connotation. So it can be stated with low knowledge or low lack. Saan bang mas maganda pakinggan? So I think this one. Low knowledge. Is it just about the knowledge? How about Zella? Miss Biboso? This is correct, okay? This one here. But is it just limited on knowledge?
I think ma'am also considered the perception or their attitude towards OTC analgesics.
Perception or attitude on OTC analgesics. Okay, that's a good point. So, use or effect. Okay, so those are things that we have to ask ourselves. Bakit nagkakaroon ng maling paggamit ng OTC analgesics in the community? Does our neighbors, our friends, do they know what is the analgesic for? Or ano yung kanilang perception for analgesic? Baka ang perception nila for analgesic is that helps them wake up every day without any muscle pain. So baka ibig sabihin umiinom sila ng analgesic para kagaya ng indication ng mga vitamins, 'di ba? Or like yung may mga ginseng, or may mga energizer na mga preparation. So that is a wrong perception of the drug. Or baka yung attitude nila on using, kasi may nakita kayo or may nalaman kayo ng friend na nasabi dito ni Nathaniel na nagsi-self-prescribe kasi ayaw niyang pumunta sa doctor, or natatakot siyang pumunta sa doctor. So there's something wrong in the attitude of your friend or of your family member. So meron kang experiences na paulit-ulit na ganyan. So that's the problem. So that will be your research problem. So yun yung i-develop ninyo. So etong laman ngayon ng paper, diyan papasok yung inyo, again, ulit-ulit si ma'am ha, diyan papasok, i-draft ninyo yung inyong research problem, you will present it properly that it will come out significant. You will present the research gap, meaning to say, meron namang mga nilalagay na mga posters sa butika, meron namang mga advertisements sa TV kung paano at kailan uminom ng analgesic, pero bakit meron pa rin improper use? So ano yung gap? So I will give an example of a gap. Maybe there is no interaction when they bought. There's no interaction with any pharmacy technician or pharmacist when they bought the drug over the counter. So yun yung gap. So with that, you develop your introduction, your research with the research problem that it can present the urgency, the importance, the significance, and that should be supported with related literature. So I will cite literatures here embedded ha. This one is a literature. This one also. So ito sila, these are based from readings. Hindi pwedeng magpipaste-paste ka lang dyan na hindi mo binasa kasi hindi buong papel ang ilalagay ninyo sa introduction. Meaning you will read really the related studies you will understand the output or the outcome of these different studies, and you will process it and write it in your own words, paraphrase it, and embed it here in your paper. So this one. Okay, ito yung mga literatures na sinasabi ko. So, di ba may section tayo sa undergraduate thesis natin. Chapter 2 is for RRL and RRS. But for IMRAD, it's just like this. It will be embedded like this. So, yan. Nandyan na din yung ating theoretical framework as well. So, sabi dyan, ito yung ating pwedeng framework. Asan na yun? Ito yung gap. Are you seeing this? Ito yung research gap. So you will arrange it properly. Ito yung general objectives. So to reduce misconceptions about analgesic. So yan yung broad research problem. And the following, ito siya. These are, this study, this part here. Ito yung ating, sakit sa mata itong green. Ito yung ating specific part doon sa problem. That is the objectives of the study or the statement of the problem embedded in the introduction. Are you okay with this? Naintindihan nyo? Naka-follow kayo, class?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Okay. So,
Yes po, ma'am.
ayun na. So, the following, itong mga next paragraphs are some of the components of the introduction. Okay? So, yun yung ating sample 1. Any question before we can move forward to the methods? Okay, are we good with introduction? So sa methods, class, it is good that you will, it's better if you will use subsections para mabilis makita or mabilis siya hanapin. Kasi distinct naman talaga siya from each other. So this one, research design. So yung na-mention natin last meeting, research design, you will lay down here what is the research design that you will use for the study. So, etong sample study natin, it will use descriptive quantitative study. So, when you say descriptive, di ba, na-mention ko last meeting, a descriptive study needs demographic data. Yan. So, si demographic data, pwede natin siyang i-quantify. So, paano yan siya ngayon ma-quantify? That will be using research instruments. Okay. So, let's have the following. So, si research local, kung saan kayo gagawa ng survey or saan nyo gagawin yung inyong study. Research subjects or respondents. Sino ang respondents ninyo? Kanina sa isang study natin, sino yung respondents natin? Sa yung first study na na-mention ko, Denise. Sino yung ating research respondents? Miss Denise?
Yes po, ma'am.
Yes?
The ones who, the people, the respondents are the patients or the customers that have have parang yung wala masyadong knowledge about the non-prescription drugs.
Okay, the consumers that buy OTC analgesics from the
Yes.
community pharmacy. Okay. How about the other study that I presented on yung
The
first
pregnant
study
women,
kanina?
Yung first study.
Mothers.
The
Okay.
mothers.
The mother. It can be pregnant or it can be na nakapanganak na but mothers. Sige, yon, very good. So those are the research respondents. You have to specify ano yung kailangan na research respondents. Research instruments. So itong quantification of your data will be quantified. How can it be quantified? It will be using research instruments.